there's not one single food that we ask people to eat that they haven't been eating throughout their lives. Yes, we are asking them to not eat the foods that are destroying their endothelial capacity to make nitric oxide. We want them to stop that completely, yes. Now, there are some who say, well, it wasn't randomized, it wasn't somehow, it was just, wasn't large enough, but here we did have the data. So what we decided to do was we repeat it. This time, close to 4 years, this time not 18 patients, but 200 patients, 2 lost to follow-up, so 198. Of those 198, 177 followed the program, and 21 did not. So we had a compliance rate of 83%, almost 90%. Now, many physicians have seen, understood, and decided they would try to adapt our approach. And I'll hear from them and they'll say, Dr. Esselstyn, maybe 1 out of 50 of my patients will do this. How do you get 90%? And I think this is key. The way you get 90%, the most important thing you must do if you're going to get a patient to make a lifestyle change, you have to show the patient respect. The only way that I know how to show a patient respect is to give them my time. So at the present, I work at the Cleveland Clinic Wellness Institute. And once a month, usually for no more than 12, 14 patients, always from throughout Canada, throughout the United States, or from overseas, these patients come to Cleveland, and they're going to learn all about how they have created their disease, and precisely how we are going to empower them as the locus of control to halt and reverse their disease. And the other thing that I think helps, 2 weeks before we have our seminar, my secretary will send to me a list of the people who are coming and their phone number. And I'm old-fashioned enough that I insist on personally calling every one of those patients myself to get my arms around their story, at the same time provide them an opportunity to ask questions of me, so that coming to this seminar, we have a strong platform from which we can all move forward. And then we always give them a very hefty notebook of everything that they have learned, a video of the entire seminar that I filmed from an earlier one. And then we always have several local or regional participants who've had a previous successful experience share their story with those who are in attendance, who can then say to themselves, listen, if he or she can do this, I can do this. And you're wondering how no, they were sick. 119 of the 177 had already had bypass surgery or a stent. The second line down, patients avoiding intervention. This, to me, really is exciting. When patients are in the middle of having a heart attack, no question, a stent or bypass may be life-saving. But when these procedures are offered electively, not an emergency, it's very clear if they're willing to make this transition, they don't have to have the intervention. This was actually very clearly shown 2.5 months ago at the American Heart Meeting in Philadelphia, a study called ischemia. And that word means that these were all persons who had deprivation of blood supply to their heart. And then there were 5,000 divided into 3 groups: optimal medical therapy with stents, optimal medical therapy, bypass, optimal medical therapy alone. At the end of 5 years, no difference. My criticism of the study, optimal medical therapy, I would have preferred to have whole food, plant-based nutrition. All right. So what about the results? We did have one failure, a gentleman who had a tendency to have high blood pressure when he was in China, just eating off the economy, all that salt, and had a small stroke from which he recovered. The other 21 patients who were not adherent, 62% had progressive events. And here what I've done is sort of compare our results. If you go up on this line, this is major cardiac events, heart attack, stroke, and death. Here is the Mediterranean diet from Lyon, France. At the end of 4 years, 25% heart attack, stroke, and death. Columbia Presbyterian Hospital, and this is the natural history of coronary artery disease, 20%. Bill Bowden's Courage study, 19%. So somewhere around here, 22, 23%. And here we are, 0.6%. That's over a 30-fold difference. What's going on here? Here's what's going on. Ever since the days of Hippocrates, there's been a basic covenant of trust that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today, in cardiovascular medicine, that's not being done. I think it's why 4 years ago, I was invited to become a member of the American College of Surgery. A little unusual for a general surgeon to be in that group. However, they asked me to become a member of their nutrition committee because we're trying what we can to get cardiologists to be aware of the causation of the illness that they have been designated to treat. Now, of all things, on that same month, July of 2014, I wrote another paper of 3 patients. Why? Because these 3 patients, to me, were the absolute personification of the failure of present-day cardiology, although in several of those patients it was from my own institution. Now, the first patient, Bob Mercer, is a gentleman from Newfoundland, Canada. I have yet to meet him face-to-face, but at age 44, he had a complete blockage of the right carotid artery to his brain, had a small stroke from which he recovered, and then he had such horrible angina, they found a courageous surgeon in Toronto who would operate on him, even though he had one totally blocked artery to his brain. But he had a great result from that surgery. Now he was 69 years of age, and he was in trouble. He'd gained 40 pounds, he was diabetic, he had all this angina back, he had erectile dysfunction, and his one remaining carotid artery was now 90% blocked. So, of all things to have happen, his 37-year-old daughter had a heart attack. And during her convalescence, she found a book, Prevent and Reverse Heart Disease. And she said, "Pop, we got to do this together." They did. A year later was my first awareness of Bob Mercer. He wrote, "Dr. Esselstyn, I wanted to thank you. I have lost 40 pounds. My diabetes has disappeared. All my angina has disappeared. My erectile dysfunction has disappeared. And my one remaining carotid artery, which was 90% blocked, is now 67% blocked." And here, I think we've got a picture of Bob Mercer. Art Soteros, in a suburb of Cleveland, at age 32, heavily, much overweight, developed diabetes. Age 42, chest pain, angina, and at the Cleveland Clinic, the first of 14 stents over 7 years. Then he was told, you got aggressive disease. You're going to have bypass surgery. So he did. And that was good for 12 months. More angina. So his wife, he was told by the doctors, you got this aggressive disease. You'll just have to see what you can do on drugs. His wife found out about this. He came. He was marvelous. Lost 40 pounds, got rid of his diabetes, and got rid of all of his angina. And the next, Jim McNamara. On the left, you can see he was before he lost 40 pounds. He was pre-diabetic. And he had to have surgery on a partially blocked carotid artery on the right side. It was a total failure, and it just simply closed off the artery permanently. Then he began getting pain in his left calf. He was found to have a fair amount of disease in his arteries to his leg. They said, you'll have to have surgery. The first one failed. Second one failed. Third one failed. Told you've got this aggressive disease, you'll have to get along on drugs. Whenever he put his leg up at night to get in bed, within minutes it would start this numbness and tingling that would drive him crazy. His wife found out about us. He came. Within 4 months, all of his leg pain was disappeared. No longer had any pain putting his leg up at night. Lost 40 pounds, got rid of his pre-diabetic state, and here he is dancing with his daughter. So, summarizing, comparing to stents and bypass, comparing the diet, there's no mortality. You're eating Brussels sprouts and broccoli, you don't die. No morbidity from the diet, no added expense. The benefits improve with time. And to think of it this way, the poor patient who has had a heart attack is walking around with a sword of Damocles over their head, wondering, when do I get my next heart attack? Nonsense! You never have to have another heart attack.